back. This is the final stretch of Talk to Doc, and we're taking some questions from our studio audience and email senders. Okay? Questions?
Questions.
Hi, Doc. Ano ang pwedeng gawin para hindi maulit ang injury?
Basically, ang kailangan natin malaman is yung technique tsaka yung sport kung saan ka interesado. So, meron kasi mga sports na predisposed para magkaroon ng certain injury. Yung katulad nangyari kay Jens, basketball yan. Halos lahat ng kilos pwede mangyari sa kanya. Pwede mangyari kahit kanino. If you are interested in long distance running, meron din wear and tear on the knees. So basically, kung interesado ka kung paano maiwasan yung isang injury, proper training, kailangan malaman, and then yung general health mo, no? Kailangan natin siguraduhin na wala ding ibang problema.
Now, we've got a question via email, and it's from Nina. I'm overweight and I want to lose weight through sports. What can you advise me?
Yes, thank you for that question. Generally, we need to first find out if you have any existing medical problem. The reason for this is if you're interested in participating in sports, the question would be what kind of sport, and your ability to engage very heavily in that sport depends on what are the existing medical problems. So my number one advice is consult first a internist who can identify if there are existing medical problems. Number two, if you have already determined that you are overweight, what is the amount of weight or pounds that you need to lose? So you need to consult a dietitian or a nutritionist who can also fix your diet. And then number three, come and see an orthopedist who can plan with you what kind of sport and how to go about with your weight reduction program.
Kasi, di ba, if you're overweight and then you do running, it's gonna stress your knees.
Right,
No?
right.
Okay, next question.
Hi, Doc. What do you advise your patients to do after the surgery?
Yes, for Jens, the treatment didn't end with the surgery only. Like any kind of surgery, there is a recovery process. So Jens needed to undergo 3 phases after his surgery. The first phase after orthopedic surgery is range of motion or movement exercises to progress to muscle strengthening exercises and then muscle endurance in that order. Hindi mo pwedeng i-shortcut yan. Okay? And so it's important that you follow the rehab program. Basically, it will take 4 to 6 weeks to recover from that kind of injury.
Yun, ang tricky doon yung rehab. Kailangan sumunod sa doktor.
Kailangan gawin.
Here's another question sent through email from Susan. After a knee surgery, how long before a patient can return to sports?
Yes, the time to return from sports depends largely on the nature of the injury. For Jens, it took around 4 to 6 weeks. He was a little bit tired after the season, so it probably stretched an extra 2 weeks. For other conditions, which is commonly encountered in knee injuries, which we call the ACL or anterior cruciate ligament injury, the return before back to sports can take as early as 6 months or as late as 9 months through an extensive rehabilitation program. So it largely depends on the kind of injury that the patient sustains.
So I believe that. Kind of injury plus the kind of dedication you have in rehab.
Yes.
Yes.
Next question.
Good evening, Doc. What is the first aid for injury?
Basically, if you're on the playing field and there's no medical personnel involved, what you should do is do not try to manipulate the injured part. Yung ginagawa ng mga iba, hinahatak na lang yung limb or hinihilot. So the first thing is to immobilize. Okay, if there is no splint available, they say even using a rolled up newspaper around the limb can temporarily act, then you can fasten it with handkerchiefs or with or bandanas, okay, and then apply ice right away, and then take the patient to for medical evaluation to any emergency room where he can be evaluated by a doctor.
Yun, evaluation is important also. You really said a lot of things that are close
Helpful to you.
Yes. Any parting words for our viewers, Doc?
Yes. What happened to Jens is actually a condition that can happen not only to athletes but even to the ordinary person. With downward and twisting force, you can damage your cartilage. Luckily, the Medical City Department of Orthopedics does the procedure, the minimally invasive procedure, to be able to take care of these injuries. If you're interested in sports for whatever reason, for exercise or for fitness only or just to lose weight, it's important that you are seen by an internist to determine your level of health. And then after that, you can come to the Department of Orthopedics, Ortho Multi-Specialty Center, and the Spark Sports Performance Center, and we can plan with you a good exercise program.
Okay, thank you very much for sharing your expertise with us, Doc Mikey. Thank you also to our televiewers and our audience for your questions.
Yes, next week we'll be tackling the medical benefits of robotics. Let's know what you think, and for your questions regarding this topic, email them at talktodoc@medicalcity.com.ph. I'm Dr. Oyi Balburias.
And I'm Maricel Laksa Pangilinan. Remember, don't be afraid to ask because we can talk to Doc.
Your doctor has seen many different patients, but none exactly like you. You are unique. The more your doctor knows you, the better he can help. And the more you know about your condition, the better decisions you can make. So tell your story, ask questions, talk to doc.
Your health depends on you and me.
A message of concern from the Medical City.